Yan, so good day po. We are from Group 4 and we will be performing the transferring a patient from stretcher to a bed po. I am Jean Mendez Bustamante.
I'm Carla De Castro.
I am Francine Ferrer.
I am Jason Tacanesh Mimotoya.
I am Gwinnett Reyes.
I am Ricardo Tilio.
I am Miguel Pasay.
And I am Alexandra Maybe Melgal.
And may I know for your name po, your birthday and medical record number po. And so, let me check for your wristband po for further verification. And thank you po. The act of transferring a patient from a stretcher to a bed po necessitates the secure and cautious relocation of an individual from one surface to another, guaranteeing the meticulous alignment and comprehensive support throughout the entirety of the process.
So the objective of transferring a patient from bed to stretcher or stretcher to bed is to offer an enhanced and secure resting platform, thereby easing medical interventions and guaranteeing the safety of the patient.
So before doing any procedure, may I ask po if we nurses should be aware of any cultural sensitivity such as religious belief and personal beliefs? No naman po. So okay, before anything else, may I ask if you want some privacy po? Okay, thank you po.
So there are 5 moments of hand washing. First is before touching a patient, before a procedure, after the procedure or body fluid exposure risk, after touching the patient, and after touching the patient's surroundings.
Now that we are done with infection control, we can now proceed on wearing the different personal protective equipment such as donning fresh gown, wearing on the mask, and putting on the goggles as well as the gloves.
So let us now start with the procedure. First is we will adjust the client's bed in preparation for the transfer. First is we will lower down the head part of the bed that is tolerable by the patient. Okay, so let us assume that the head part of the bed is now lowered. Now we will put a friction reducing device underneath the patient. So we will put the patient in a lateral position. And then another nurse will put the friction reducing device. Okay, next is we will raise the client's bed higher than the surface of the stretcher, preferably at least half an inch. So let us now assume that the client's bed is now higher than the surface of the stretcher, that is at least half an inch.
Now we're gonna ensure that the wheels of the bed is locked. After that, we're gonna put the stretcher parallel to the bed. So we have to assume that this is the bed and this is the stretcher. Now we're gonna put a bath towel in between the gap of the bed and the stretcher. And now we're gonna transfer the client securely to the stretcher.
So if the client could transfer independently, encouraged to do so and stood by for safety. If the client was partially able or not able to transfer, one caregiver was at the side of the client's bed and between the client's shoulder and hip. So
Now the second nurse should be positioning themselves between the shoulders and hips, and third nurse should be positioning themselves between the hips and the lower legs with a walking stance to provide a safety and comfort to the client.
On a planned command, the caregiver at the stretcher side pulled, shifting weight to the rear foot, and the caregiver at the bedside pushed the client toward the stretchers, shifting weight to the front foot. But before that, yeah, we're going. On the count of 3. 1, 2, 3.
Bakit On
Dito ba
3,
yung-
pa. 1, 2, 3. Ayan. Okay.
Now we're going to proceed on making the client comfortable by fixing his position. Okay. So now we're going to unlock the wheels of the stretcher. As for the stretcher, we're going to pull it away from the bed. Now immediately raise the side rails of the stretcher for the patient's safety. Also, we're going to fasten the safety straps across the chest of the patient, across the abdomen, and across the legs. Now that the client is ready, he is now ready for transferring.
So for the other variation, we are going to transfer the patient using a transfer board. To do that, we need to turn the patient into a lateral position facing away from us. And then put the transfer board at the back of the patient, close to the back of the patient. And then roll the patient into the transfer board. And then pull the transfer board and the patient across the bed to the stretcher.
So on a plan command, the caregivers on the stretcher side will pull the patient, shifting weight to the rear foot, while the caregiver on the bedside will push the patient towards the stretcher, shifting weight to the front foot. On 3. 1, 2, 3. Okay, so throughout the procedure, it is very important to ensure that all the appropriate body mechanics are done, to ensure that the patient and the nurse is safe and that there are no further injuries that will be done to the patient. And it is also very important to use appropriate assistive devices for handling mobility as the requirement for the patient. And it is also very important to communicate well to the patient to ensure that the patient understood all the procedures that will be done, and it is also a way to ask for the patient's cooperation and to ensure that the patient also gain its independence throughout the procedure.
Now we're gonna document all the relevant information that we do, including the date and the time.
Now we will explain the holistic nursing that includes body, mind, soul, and psychosocial, the nursing care.